Hello, I'm Dr. David Smith, President of Upstate Medical University, and I have the distinct honor and pleasure of welcoming you to your new children's hospital. What follows is a videotaped tour of a much-needed facility in our community and region that was built with the dedication and the generosity of nearly 8,000 donors throughout the central New York region and beyond. As one of those donors, I hope you find it as gratifying as I do to having participated in such a historic project. Your support is greatly appreciated, no more so than by the parents whose sick and injured children will be treated in a setting that is nurturing and family-centered. As you watch this video, take pride in knowing that you helped to make this happen, from private patient rooms, a family resource center, schoolroom, performance center, and much more. All the amenities that make a hospital a children's hospital. Welcome to your Upstate Golisano Children's Hospital.
Usually when you have a fund drive, you try to get some major donors to come in at the ground level and give some money in a quiet phase. Well, we did it totally opposite. We started with the employee campaign at Upstate because we felt it was very important that before going out into the community and asking people to give, that we would support this. We established a booth at the state fair, and we went to the schools, to the school children. We had hundreds of small fundraisers that children in the schools did. They'd make pots and sell them at the carousel center, the car washes, whatever you can imagine. But what was amazing was the huge number of groups that contacted us. Rotaries, differing neighborhood groups, all wanting to have special fundraisers. And throughout all of this came this tremendous grassroots support for the Children's Hospital. By the time we were meeting with Tom Golisano, he was so impressed with the tremendous support that he wanted also to be a part of it.
Syracuse, New York was, until now, the largest city in the United States that didn't have a children's hospital. Every other American city larger than us recognized long ago that children needed their own separate designated healthcare facility. So by opening this hospital, it really symbolizes the commitment of this community to providing a level of healthcare for children that's appropriate for the 21st century. The idea of the treehouse is to provide not only an architectural icon for the community, but it's also intended to be the space where the community and the hospital intersect. So you'll see in the treehouse, for example, a large performance center. You know, we've got all kinds of sports groups and arts groups and performing groups that come by the hospital. Right now we don't have any place to showcase them. Now they can be right in the performance center. A cafe, a chapel. One of the other features of the treehouse is a very large solarium, which is on all sides, has glass. It will have some large toys and games in it that children can play in. If the families want to bring along some family friends and they need a little place to get away, have a cup of coffee, the treehouse is the spot for that to happen. So the treehouse is really the intersection between the community and the hospital. The rooms are larger, they're brighter, they're more colorful. We have exclusively one-patient rooms. There are no rooms with 2 kids or 3 kids or even 4 kids, which is what we had previously. The rooms have built-in places for families to stay. Now every single one of our 71 rooms has an area that will be large enough for parents to stay in. We do have some separate family sleep centers, though, for family members that need to be close by, that don't want to be a few blocks away in the Ronald McDonald House. We have a lactation room that's capable of being used by both family members and parents for their own child, but also for our staff. We have a small gallery. One of the things is we hope to have rotating exhibits of art by some local artists. We have a family resource center that provides a physical space that families can come to, ask questions, sit down, read the paper, sit by a fireplace, feel comfortable. But the Family Resource Center is going to be staffed by an expert in medical information. We have playhouse or playrooms. Actually, I said playhouse. They sort of look like playhouses that will be designed and have equipment for toddlers. But we also have ones that would have equipment and be designed appropriate for adolescents. One of the things we try to do is make sure that the patient rooms are safe places, that we don't do any kind of treatment that could potentially be painful in a patient room. So if a child needs to have an IV started or to have some type of procedure done, they're taken out of their room and brought to the treatment room for that to happen. The hydrotherapy room, children that need to have certain types of wounds care for, hydrotherapy, warm water with jets will help to do that. Children with burns will be helped with that. Children with certain types of pain, especially the pain of sickle cell anemia, may be helped by getting into a hydrotherapy unit. We have a rehabilitation and physical therapy room so that children that are recovering from accidents, maybe needing to learn to walk again or needing to learn how to walk with crutches or some type of assistive devices. We believe it's very important as much as possible to make life normal for children. And a normal part of life for children is going to school. So not only do we have a schoolroom, but we have a school teacher.
Those of you who have been involved in this campaign have literally changed the lives of children and their families here in Central New York. Thank you on behalf of all the children. We could not have done it without you. But what you have done is made this beautiful facility a beacon for healthcare, education, technology, and service.
Obviously there's an impact because we have more beds. That means more employment in the community. That's good for the economy. It's good that more healthcare can be centered in one place. It means potentially that patients and their families aren't going to have to leave to go to Rochester or Boston or New York City to get services for their children when they're sick. That's really a very positive outcome for children and their families in Central New York.
We have a staff of physicians and nurses and ancillary medical personnel that provide really high quality medical care to children. If you think that we were able to give high quality patient care in a structure built in the middle of the last century, you just wait until you see what they can do in this place.